Hi, Alekia, and welcome to the Health After 30 podcast. I'm excited about today's conversation as you are the first person I've talked to who is a genetic counselor. So you're actually the first person who's even brought this topic to my awareness. So thank you so much for being here.
Thank you, Alana, for inviting me to be on your show. And very glad to be able to talk to people about genetics. And just like you, I think a lot of people are unaware how far we've come and how we can use genetics today to actually change our health for the better. And I would love to tell your listeners more about that.
Yeah, so let's get into it. So genetic counseling, what does that mean? What is that? What defines this?
Yeah, so usually genetic counselors are healthcare professionals. They're not doctors, but think of it as something similar to a nurse practitioner training. It's a clinical master studies, and we are experts in genetic disease and genetic testing, but also trying how to explain those topics to people just because genetic testing is not your average blood test. It involves a lot of very difficult decisions, especially before when the profession originally started. There was no therapy, there was no gene therapy, then no treatment. We didn't even know how to identify the exact genetic disease running in families. So that's where genetic counselors came in and really tried to support these families to understand if this is something that's running in families. Is there something that they can do? What are the risks for other people? Will their children get it? Will they themselves get it if their parents had it? And also, sometimes people would have to make difficult decisions about family planning or how to adjust their lives because they might be at risk for developing neurodegenerative disease later in life. So things like that. And that's where I think the counseling aspect started. Like there was a lot of psychosocial decision making involved. And then, of course, the genetics piece is really doing these family risk assessments, understanding your family medical history, and seeing what the patterns are and which disease this could be. What is the right test for you? Because we understand more about genetics, and then helping them with that test. And since the results are complicated, guiding them with the results, what it means for them, what to do with this result. Can this clinically translate into me not getting the disease or reducing my symptoms? Is there a treatment available? So informing treatment and management. So we kind of support that entire ecosystem of genetic diseases, genetic testing, and helping patients and individuals and healthy people today.
Yeah, I think there's a lot to unpack here because there's so many different factors that kind of come into this. But I just want to start by saying, so genetic testing has always been around, right? We get, you can get genetic testing, but I guess where you come in as a counselor is it's once you've got these tests or once you've got the information, the patient then sits there and thinks, great, I've got all of this information. Now, what does that mean? What do I do with this information?
A lot of times people are not getting the most appropriate test for them. And genetic counselors can also help so we call it the pre-test counseling, although a lot of that now is moving more into other mainstream physicians because there's so many tests out there.
Can you give us an example of what an appropriate test would be if someone is going, because they would obviously talk to their doctor about it, or do they just test without? Like, can you walk us through that? What's an appropriate test that someone would need then?
Right. So usually what happens is the average physician is not well versed in genetics. So they themselves do not really know which test to order. So a lot of times when they see someone at risk because of family history or the symptoms look like this could be genetic, they refer people on to a genetics clinic or a genetic counselor. So there's physician geneticists who usually also see patients and genetic counselors, and they can work together as a team when trying to identify what this patient has or what this individual has. So one is diagnostic. So you are seeing something, they're referred into genetics, and then if a physical consult is needed, the geneticist physician comes in, diagnosis, looks at that, but then the entire understanding the family history, explaining that to the patient is all done by a genetic counselor. But now more and more genetic counselors practice on their own or with other professionals. So like say neurologists, cardiologists, nephrologists, OB gynecologists. So really in every specialty now genetic counselors practice because there's genetic conditions that hit every single one of those specialties. Or say it's preventive before you get pregnant, or you're adopted, you don't know your family history, or you're just a healthy individual who's curious as to whether this can actually help you prevent getting cancer or getting any heart diseases. So in all of the situations, either their patients can be referred on to a genetic counselor just to discuss their risks and their family history, because the average genetic counseling consult is about 45 minutes to 60 minutes. Your physician is not going to sit with you to do that. The most you get is, are there any diseases in your family that that have been in multiple generations? No? Okay, move on. So that's the family history question you get from the average physician. But we actually take a 3-generation family medical history as a genetic counselor to really understand whether there could be an increased risk for genetics. Same thing with, say, if someone has had recurrent pregnancy losses. Most women have had a screening for Down syndrome, and Down syndrome is a genetic condition. It's a very specific type of genetic condition, but even though a DNA test was not done before, a biochemical test was done as to what metabolites are being released by the placenta, right? So that's what's measured, but ultimately it is looking for a genetic disease.
Genetic testing, I feel like it can be a very two-edged sword, because on one side, knowing our family history and knowing perhaps what we're predisposed to, very insightful, very, like, it's great for us to know, we can prepare. On the other side, knowing what we might inherit can also be quite daunting. So when you're walking someone through this, what is the perhaps statistics, or what's the general feel that people are getting with this information of, okay, this is what I'm inheriting or I'm predisposed to?
Yeah. So one is the people who already know there's something in their family, and they are seeking it out because they've seen that, and then they are worried that they might be at risk and they really want to know. And there are people who think they want to know, and then after having a discussion, especially for neurodegenerative diseases, they decide that they don't want to know, especially for those where there's no treatment, no therapy. So they might come in thinking they want to know, they'll think about it, and after having a conversation, decide that no, and then just leave. Or some of them even get the test and then never come back for the results because they change their mind, or they come back 10 years later. So I think it really depends on the individual's personality, because I talk to a lot of people in, the younger generation who are these biohackers and very health conscious. And they're like, why would you not want to know? Have you had your genome sequenced? So I have never had my genome sequenced because there is no indication to, because we're still at a point where if you're completely healthy, it's still not going to tell us a lot unless there is an indication. So as I mentioned, for healthy people, there are some indications where it makes sense. So you and your partner are looking to have a child, or maybe there are certain cancer conditions, some heart conditions. It makes sense because we think the incidence is higher. So maybe your family tree is quite small. Maybe a lot of people died early, so you don't have enough information. So it might still benefit you to do that, because for those conditions, we actually have guidelines of what to do and how to manage. But just doing a genome on a healthy person at this point in time, it's great to have, but ultimately you're still only going to look for that 100 genes or 50 genes where we know how to manage it medically. The rest is just not relevant, because what are we looking for? So we're not there yet. Maybe we will get there with all the big data and everything that's coming out slowly with all these biobanks and the UK Genome Project and all of these, but not there yet. So maybe in the next 5 to 10 years, I think we will see an explosion of this, especially genomics combined with metabolics and proteomics, where you're looking at the DNA, but you're also looking at how that DNA is being expressed, and then combining all of that to see, what is going on, rather than just, this is your DNA, you have this change, this mutation, this disease-causing change, but we don't know how severe it's going to be, or at what age exactly you're going to get it, or 2 siblings, which one is going to be more severely affected than the other. So right now, a lot of times we can't even predict that. So in the same family, different people can be affected differently with the same disease.
Genetics is one thing, but epigenetics is also on the other side of that, correct? So even if you have the genes, and I think, this also comes into the people of not wanting to know, or the biohackers wanting to know, because once you get this information, I guess moving forward with the information that you have, I guess it's what can you now do? And if there are diseases which are perhaps not treatable, or they don't have the treatment yet, What can we be doing in our lives too then? When I hear you talk about this, I think, what can we be doing in our lives to kind of straighten up what we're doing? How can we perhaps start to live the life which is going to perhaps prevent the predisposed genetic, inheritance, that happening sooner?
There's diseases which are very high risk caused by a specific gene. So we all have the same 20,000 genes, 22,000 genes, out of which we right now know that 5,000 cause very specific disease. So this gene is responsible for producing this protein. If this gene has a mutation that makes it not work, we don't have this functioning protein, which causes all the symptoms because it's not doing its job in the body, right? And that all those symptoms put together is a genetic condition. And there are ones where you're born with that mutation, you will get the disease. Either at birth you already have it, it's congenital, or over time you develop the symptoms and you have the disease at birth. So, and these are very high risk. And then there are ones where predispositions, right? So you have it, like say for the breast cancer, the BRCA gene, you have a mutation,
Mm.
but it's an adult onset condition. It takes some time to develop it. And there are definitely other modifying risk factors that say, so it's still not 100% risk. It's not that you're born with breast cancer. So it's
Mhm,
still,
mhm.
what are you doing to mitigate it? Are there other genes that are actually minimizing your risk, increasing your risk? So some of them are still a predisposition with, 80%
Mhm.
chance by the time you're 80, but it's still not 100%. So that's where there is the definite causative 1:1, you have it. Then there's the ones where you have it, you're super high risk, but it's still not 100% chance. And then you have all the genetic ones, which are most of them where it's an interplay of multiple genes, the environment, and your lifestyle. And what I like to
Mm.
say for this is an analogy that comes from mental health, where they're like, when people ask, is it inherited? Am I going to have a mental health disease? A nice analogy is it's called like a glass model, where you're born with a certain number of genetic factors. Either some people have a lot of them, some people have less, but then how much of the environmental and the lifestyle factors you need for it to overflow and cause disease. That's like the
Yeah.
interplay of all of them. And then what you can also do is do protective things to increase the size of your glass. So for example, you maybe are at high risk for skin cancer, but then you use sunscreen, you don't go out a lot, you are always covering everything. So you're increasing the size so it never overflows and causes disease. So many different kinds of genetic diseases. And some of them we are better at detecting now and making like creating treatments for, and those would be the causative ones, right? So because this gene is broken, this is the protein, I give it back to you,
Mm.
similar to like diabetes and insulin. It's not working, I give it back to you, you're fine. Or I
Yeah.
repair that gene by
Mm.
giving a virus with the normal copy of the gene, that's gene therapy. So you produce the protein normally. But the ones
Mm.
which are more multiple interplay environment, so these are the ones where you can do something, but how much and it's going to mitigate it. So it's all very, you can't really measure it. And that's the hard thing.
Is it important then for people to get tested for all gene types, or is it just the ones that are definitely causative?
Yeah. So I think for the moment, I still think it is like a tiered testing, right? So I think the most important thing to ask people, and that's what we do when they come in for counseling, is what is it that you're looking for? Like, why, what are you worried about? Are you thinking, is it just a passing fad because everyone's doing? What are you looking for? And really getting them to understand that. So if something is really high risk in the family or they're worried about something inherited, then we recommend doing testing specific for that, or there's already something known
Mm.
in the family, then test for that. Then I would always recommend
Mm.
people, because we are at a point where we can do something to test for before having children, that you and your partner, even if you decide not to do anything, whether, you say, hey, I will never terminate, or I will, just, it's not interesting to me because, it doesn't matter. But still, it's good to have the information because
Mm.
termination. A lot of people think, oh, genetic testing, people are doing it to terminate pregnancies. I'm like, no, that's not at all the reason. But if you know ahead of time, you can prepare, you can talk to other families who have a child with that same condition. You kind of can then decide to
Mm.
deliver in a tertiary center where all the experts are available. So you can really prepare yourself for
Mm.
the birth of this child who might have special needs,
Mm.
right? Or start
Mm.
therapy on day one so they don't end up having any symptoms if there is a therapy. So I really
Yeah.
recommend people who are planning to have children to talk to someone about genetic testing for themselves and their partner to see if they're carrying something
Hmm.
that they can pass on to their child. I also recommend people to think about genetic screening during pregnancy for the same reasons. The ahead of pregnancy you do it, you also have more options, especially because you can also go for IVF, and it just opens up more options for you. The other one for healthy people is what I call proactive screening for certain
Hmm.
conditions where we now have guidelines. You can prevent it. So, certain cancers where if you know you're a carrier, you can start screening ahead. So, if breast cancer screening starts at 50 normally, if you have this BRCA change, this mutation that you know are at high risk, you can start screening much, much earlier. So, right away, as soon as you find it, then you can start screening, right? And then you also know what other cancers you're at risk for, because you're also then at risk for ovarian cancer,
Screen.
which has very bad screening. So how will you plan your life around that? So things like that,
Hmm.
or heart diseases. And we know, especially for women right now, the cardiovascular, it's so behind. Research is so behind. And the symptoms, we don't even know for women what the actual symptoms are because they're very different from men. But there are cardio conditions where if we know the mutation, if we know that this person is at risk, you can be monitored for it. And similarly, there are some metabolic conditions which present as just very random symptoms. And in the end, it turns out that this person cannot process copper. And the fix is very simple. You just have to get the copper out of the body. Or the same thing
Mm.
with a disease called hemochromatosis. You store up a lot of iron in your body.
That's a really nice way of putting it. I was going to also say there's so much preventative work in this, in genetic testing and also genetic counseling. Our healthcare system, and when I say our, I kind of think, the Western world, America, Australia, in Europe, we're not really putting the emphasis on that preventative care. Is genetic testing and genetic counseling covered by any type of insurances?
So the medical ones, yes. But every country, the way each country does it is slightly different. So as I mentioned, usually public systems, say the UK, I'm guessing also Australia, they put the bar very high. So they have a set of guidelines that you need to meet because they don't
Mm.
want to be testing everybody because of the cost of the system and also the cost of monitoring all these people once identified. So and also
Mm.
historically testing was very expensive, and that's also another misconception
Mm.
that a lot of people are like, oh, I don't want to do genetic testing because it's expensive. It's not anymore. The
Mm.
costs have fallen a lot. However, the guidelines have
Mm.
not changed, of course. But the guidelines were there to catch really the top super high risk people who really it makes a difference for, rather than the others,
Yeah.
because the healthcare system is
Yeah.
trying to optimize where to spend the money, right? And
Yeah.
then you have the US where some things are covered, some things are not, depending on which insurance company you have, who orders it. It's sort of all over the place. They will cover something today, but then in a month something changes in their system and they say we don't cover it anymore. And
Hmm.
mention is if people have had children, also your babies at birth in most of the Western countries are getting again a metabolic genetic screen. It's called a heel prick test. And most babies are tested for it. It varies widely between countries, but what they're looking for are treatable genetic conditions, which, if caught
Hmm.
at the time of birth, there is a treatment and these kids just need a special diet or certain treatment from day one, and they do really well. So that's also a form of genetic screening, which we've implemented very successfully. So I would say those are the two population-based genetic screens where it is genetic, but it's done in a very in a biochemical or a metabolic level first. The newborn
Mm.
screening is one of them. And the other one I would say is the prenatal pregnancy screening for Down syndrome, that now it's like standard of care. Most pregnant women are offered this as part of their pregnancy policy. And I'm hoping that as we learn more, there are countries which want to introduce also population screening for cancer, at least starting with every person who has cancer. But there are also certain, say, for example, Israel, they do have founder variants and mutations for BRCA, for breast cancer, this gene.
Cancer is such a massive topic these days that it's, so many people are being diagnosed with it. And I think if you have that knowledge ahead of time, it can radically transform your life. And also for the people, as you said, there's some people who are having all these different conditions and they're living, even if they're living a relatively healthy life.
So women with certain changes, or even men, like now it's also for pancreatic and prostate cancer. If you have a change, then you qualify for a certain therapy, or you would do well on that, and then you wouldn't have to do all these other therapies. So I recently heard, it's quite a sad story, and this is where I think it's still behind because physicians are not still following, out up there with the genetics knowledge, where not everyone is aware to order this test. Because a woman told me her story where she insisted on the test. Her oncologist was like, fine, if you really want it, I'll order it, the genetic test. And then they forgot about the results. He didn't say anything to her. She underwent all of her chemo, everything, radiation, she did everything, only on one breast. And then they looked at the results afterwards because she remembered and she asked him and he'd completely forgotten. And then when he gave her the result, they looked at it together and she had a mutation, which meant that they would have recommended her having both of her breasts removed because she's at risk for breast cancer in her other breasts as well. She's also at risk for ovarian cancer, skin cancer, pancreatic cancer, and she would have qualified for a very specific therapy called PARP therapy. And she wouldn't have had to have all these other chemo that she had. It happens all the time. And that's why I think the awareness is important, and for people to really ask for it. In my opinion, not everybody needs a genetic test, but everybody should know what is available and what the pros or cons are, and then decide if it's right for them. But that also doesn't mean that everyone should go get one of these over the counter, like the ones you can order online, because these are usually not medical tests. And that is another important point I want to make, that if you are thinking about getting a genetic test, really talk to a genetic counselor or a professional about your concerns and why, rather than just ordering something online, because the quality is really bad. None of them are medical tests. They pretend to be, but usually they are low quality, and a lot of them do not confirm. And you cannot make medical decisions based on those. So they are very cheap because you are the product. Their goal is to basically sell your data.
Yeah, the information that they gather with this, and I think now this company's gone bankrupt, and it's like, what are they going to do with all this data? So with genetic testing, what do they do with the data?
So usually, depending on the country, of course, but this HIPAA in the US, which protects your healthcare data, and then in Europe, of course, GDPR, and there's also a special Article 9 for genetic data and health data. So it's a lot of security. So if you're going to a clinical lab, a medical lab that actually does it for medical purposes, they have to follow all those rules, and they also need to have certain certifications to be able to provide medical information, right? Because doctors are using this to treat patients or to guide patients, to do surgeries on patients. So they have a certain level of quality they're supposed to meet. And that's why you can trust them more than, any random lab that opens up shop and then starts doing it. They are not required because they claim that they are not medical. So Ancestry, it's fine. There are some traits that, they tell you about, some fun stuff that they extrapolate from. It's a lot of data analysis. Like I like to say, these are all correlations because they ask you a lot of questions. Then they compare the questions with these changes they're looking at across your genome to other people who've had similar things and what they answered. So this is all correlation. It's fun. Definitely it's making these connections. But these companies now also offer some what they claim is medical information, like they offer carrier screening status for some diseases, they offer breast cancer things, or they offer like risk for Alzheimer's. So some of them are clinical data, but they still need to be confirmed in a medical lab because they are not subject to the same rigorous testing. So they should not be taken as such and medical decisions being made on that data. So I always recommend to take those with a grain of salt, the fun stuff. And then if you've opted into any of the medical stuff they offer, don't panic. Always go speak to
Mm.
somebody and then have it clinically confirmed before, yeah, in another lab that is doing medical testing before making any medical decisions based on that.
And that's a massive point as well to also get it double checked, also by a medical professional. Yeah, before making any medical
And
decisions.
also, that going back to our original point about privacy, do keep in mind that there is a lot of fine print there. So a lot of small companies especially pop up. They go bankrupt. There's another one in the UK that happened recently where a lot of people were tested through them, and now nobody knows. They just close shop, and nobody
Mm.
knows what happened to this data or who owns it, where it is. Is it in the cloud? Did they sell it to someone? Nobody knows because this company just disappeared off the
Yeah.
face of this earth. And even big companies, right? Like the one that you're referring to, 23andMe, they're not valued at anything because they're not on the stock market. Yeah, so not people are not sure what would happen to their data. That being said, I also like to say the other side of things that yes, their business model usually is to give aggregated data to other companies for research. And they
Mm.
have been instances where not 23andMe, but I know some other companies submit the data to these databases and they've caught the Golden State Killer and have, extrapolated the
Okay.
relatives from someone else.
What are the common things? So if we're thinking of perhaps if pregnancy is on the horizon or on the cards, if breast cancer is in the family, but as a woman, what else should we potentially screen
Yeah.
for?
So right now, with respect to hereditary like diseases, like the ones where there is management guidelines and there's guidelines for testing,
Mhm.
I would recommend the what I mentioned, this proactive genetic screening, where
Mhm.
certain genes that are recommended by the American College of Medical Genetics. So even if you do say a genome for some other indication, they recommend that since we know more about these diseases and can actually treat them and manage them, we should be offering these to everybody. So those are,
Mm.
they have some of the cancer diseases that I mentioned, the high risk cancers, some heart diseases like cardiomyopathies. These are some of the ones where if you watch some sports where people collapse in the field or kids who so those kind of diseases. And there's also some metabolic diseases on there where there is treatment available. So this panel I highly
Mhm.
recommend. And there's, of course, the one for pre-pregnancy, really, yeah, thinking about that with your partner to see for the most common conditions. So then this would give you more options. Or if you've had recurrent pregnancy losses or any instances of infertility, then there's also like investigations that can be done for this one. So there's one thing where therapy selection for like when you already have the disease, like cancer and things like that, or is a drug contraindicated. But for, say, psychological conditions and psychotherapy and indications in psychiatry, so medications in psychiatry, there are pharmacogenomics tests to say which ones, like these SSRIs, do you respond well, how much dosing to give. Same thing with some statins and some other drugs as well, and also blood thinners. Not everybody needs the same dose. Some people are metabolizing it faster, some people slower, and we forever have just been doing an average dosing for everybody, right?
Everyone has their own differences, also from genetics, but also their lifestyle, their size, how they metabolize and process things. So that seems like a very positive step in the right direction of where healthcare perhaps can go.
Yeah, and I
Yeah.
think for women, there are some exciting things on the horizon. We are not there yet. A lot of companies are working on it, and with all the investment in women's health, and I hope there's more and more that's going to come, because it's really terrible. Like for example, one of my pet peeves is why, like for contraceptives, right? Like women just get given these like over the counter, like OCPs and
Mm.
but birth control pills, but people do really badly on them. And we still don't have a good way to predict which woman responds well to which one and who will have very bad side effects. And the fact that they see women as, hey, let's just throw one. If not, then we'll try another one. You had horrible symptoms for 6 months. Too bad. Now try this one. Okay, now try this one. I'm like, no, that's like a lot of hormones or like just putting your body through
Yeah.
so much. So there are some companies that are like trying to see if we could do a metabolic test or a genetic test that can predict which one would be the right one for which woman. So the initial steps, baby steps, they just ask a few questions, and based on your answers, based on data from publications, they now kind of tell you which one you should go for. But the
Mm.
long-term idea is, can we use some sort of a marker or some sort of a test that will really a patient can then say, okay, a doctor can then say, take this test. Now we know which one. Here, take this medication. Same thing for
Mm-hmm.
things like endometriosis or fibroids, like who is at higher
Yeah.
risk. So these are all more of these polygenic conditions where we could never pin down one gene for it. So there's no one gene test, but hopefully with more research in this area, somebody will come up with an actual test. So there's a lot of research going on.
Does everyone who gets a genetic test, should everyone see a genetic counselor then? Genetic testing
Yeah, so
counselor?
with the medical ones, yeah, yes and no. Ideally, it would be nice in an ideal world, but I also think there's just
Mm,
not enough genetic counselors. And I think
mm,
depending on as people get more and more aware, I think not for every indication it's necessary to have a genetic
mhm,
information session. If a patient is waiting in the waiting room or they answer a few questions and they're at high risk or they say they're interested, can they actually self-learn or the family and medical history information, ask them these screening questions? If they are deemed to be higher risk, then maybe they are offered an appointment. If they are low risk, then
mm,
they are just shown some videos and asked, hey, if you still want, there are some tests that might still be relevant to you. This is the information. Please go through it. If you understand everything and have no questions, here is a consent form. A kit will be shipped to your house. And then once you have the result, then you can come in for a counseling session. Rather than do a pre and a post, we only then can talk to the people after the test, maybe even only the positives, because it's like who really needs it? Maybe people with the negative result really don't need to spend 60 minutes with someone. So really trying to figure out how
mm.
to best use of resources, right? So, but still give access to as many people as possible. So
And so in a counseling session, so because you just said someone who gets negative results, they don't need it, but what happened? Like, isn't that the whole process of walking through, like, what's next? Is that the whole point of the counseling, is to support them through what to expect, what's going to happen now that you have this information?
So negative results are also important. However, if it's someone who has nothing, they did it more as a proactive screening, it might be less important, right? So it's more, so there's no indication in the family, there's nothing, but hey, I just want to know if I'm at high risk. So we tested you for these common diseases. Still do a session with them to understand, okay, then what else can I do now? Is there another test I can do?
Mm,
What does this mean for me?
mm,
Because sometimes we think it's a disease, we order a test, it can still come back negative. Even on a genome,
mm,
when we for undiagnosed diseases, we do genomes, and then even there, we right now only have a 40 to 50% diagnostic rate. So sometimes there's still a
mhm,
lot of patients walking around with undiagnosed disease, and we really don't know because we are not looking at the right places in the genome or we don't know how to interpret it. So there's still a lot we
mm.
just don't know. And for those people, it's
Yeah.
still important to kind of then have that session as to, okay, what can you do next? How to manage this condition? If I can't tell you what it is, how can I tell you the risk for future children with that condition? So there
Mm.
are some more difficult aspects around that. So negative counseling is also very important, but less important so in
Yeah.
cases of healthy people screening. And the second thing is what we call incidental findings. So you're looking for something, but then incidentally, so you go in testing a child for the disease that they have, but then you also see that they are, carriers or like they have a breast cancer risk or something like this. So do you report that or not? So now that's why the consenting is so important. So, those are all things people should be aware of when they are getting a genetic test.
I think it's excellent that we have these resources. I think it's important, especially for people who know that they can potentially be carrying genes that they can then do something about. I'm on the fence now of wanting, like, if I were to get something, wanting to know, would I want to know that this is potentially, but not necessarily, going to affect me in the future? I find that whole process of, obviously knowing that you can do things for it, you can, look after your health, change your environment, lifestyle, diet, and all that. But at the same time, maybe not.
So a lot of people feel that way, right? I worked in a lab where we were launching this carrier screening for conditions that you and your partner must carry, and it might be helpful to know before you get pregnant. because then you can test your pregnancy or go for IVF and choose an embryo without the disease because your baby is at risk. So I actually worked for a lab that was bringing this test on, and then I said, okay, put my sample on one of the runs, and I've actually had that one done, but those tests have also grown in numbers. So at that point, we were only looking at 100 common diseases. Now, the same kind of tests, there are tests looking at 1,000 of those diseases. So I've only been tested for 100 common ones, and I am a carrier for familial Mediterranean fever. So yeah, it's triggered by eating. Yeah, the symptoms. It's not the most severe disease. So the people who are carrying it. So these are diseases where you need both of your gene copies to not work. And carriers only have one working copy and one non-working copy. So when you meet a partner who's also the same as you, then you have a chance of having a child who doesn't have both working copies. So, but the carriers usually don't present.
If someone's interested, would it be worthwhile to see a genetic counselor for a pre-screening to then get the right tests, to then get the right help? Is that the process? Is that how it should go?
Like what I said, so yeah, we offer initial consultations through our company. There's a lot of, depending on which region you're in, there's also like genetic counselors who do private practice, and they do that where you can go in, they'll do your whole family history, ask you all the right questions, understand your reasons for testing, and then tell you what the best test medically might be. And some of them can help you get that ordered and coordinated. They can find the best one with logistics wise and things like that. So yeah, so for example, we don't sell any tests. We partner with labs, and depending on the best one that we would recommend, then we, figure out how you can ship a sample and pay the lab yourself. So we can guide you with that. But we also offer these kind of education sessions where you come in based on what you told me. These are all the things that make sense for you at this time. Think about it. If you want it, this is the place to go to.
I mean, it actually just sounds like the most sensible way about going about things. Yeah. So where can we find you?
Our website is gene-links.com. And yeah, or they can always send an email through a contact form and we can guide them.
Yeah, wonderful. I think what you do and the service you provide is actually, I mean, it's so important. It's so important. And as you said, in an industry or in a space that's growing and growing, if you have the ability to talk to your family and get that information, also, as we come, into through our 30s, 40s, 50s, sometimes we don't have that access anymore. So I think while the access is there, then it's worthwhile getting into it rather than just getting into old age and then wondering, oh, I have this and that. I wonder if that could have been screened for earlier on.
We talked about older generations, but also for younger generations, right? I think it's important for you to know for your kids. But that being said, there's also, I think sometimes parents who are overzealous and they try to know everything for their kids, but that takes away the autonomy of the kids finding out for themselves. So I think there should also be some balance there, especially for adult conditions, where the kids should be allowed to make their own decision. And because I know people who actually send out their kids as samples for testing through 23andMe. And I feel like that really takes away the choice of that child to have their data in someone's database. And so, but people say, well, I'm the caregiver, I get to make all decisions. I'm like, yes and no.
I agree with that as well. Yeah, Alenka, thank you so much for being here today.
Thank you so much for having me, Alana.
Thanks so much for being here. You could have been listening to anything, but you're here interested in reclaiming your health. I hope you found the episode useful and constructive. If you enjoyed it and would like to show support for the show, please leave a review, as this makes my content more discoverable for other people to enjoy and learn from. Please also consider subscribing to the show on Spotify or Apple Podcasts or wherever you enjoy listening. Finally, the best way to show support for the show is by sharing it with someone who you think might benefit from it. Thanks for listening, be well, and I'll catch you next time.